I'm Dr. Rajani, and you're wondering, do you go under the knife or do you get facial injectables? Which is really the best way to go? Many people are confused. There's a lot of information out there. Today I'm going to look at it statistically. We're going to look at it, and I'm going to give you 6 factors that are really going to make it clear for you who wins this battle. What are the public doing? Where are they getting the results? And what treatments they're trending towards. If you're thinking about treatments, all you care about is what are you getting for your money? What should you do to get the results that are in your mind? And I'm clarifying that for you today. Take a moment, click the like button, grab your coffee, and we're diving in. Let's first look at the statistics. What are the people saying? So let's first look at surgical procedures. These are numbers from the American Society of Plastic Surgery 2020, the most recent data. Nose reshaping, 352,000 procedures. Eyelids, the same, 350,000. Facelifts, only 234,000 facelifts, and keep that number in mind, performed in the United States. Liposuction was next, 200,000, roughly 211,000. Breast augmentation, 193,000. So keep those relative numbers in mind, and let's look at minimally invasive. Now, to me, this is quite fascinating. Let's take a look. Minimally invasive cosmetic procedures decreased slightly more than surgical procedures, 60% versus 40%. Look at this, during stay-at-home orders. Now, keep in mind, that's about an 8-week period during stay-at-home orders. Now, of course, if you booked a surgical procedure, it's a lifetime event. You don't want to miss it. If you were going in for non-surgical, you can be in and out in half an hour, and at the risk of getting COVID, you're much more likely not to make that appointment or to delay it. But look at this, look for the rest of the year. Injectables continued to be the most sought after treatments in 2020, with American Society of Plastic Surgery member surgeons citing a significant uptake in demand for these procedures during the pandemic. Many clients were eager to reschedule missed neurotoxin or filler appointments, and new patients were motivated for the first time. Key, we had first timers pursue minimally invasive facial treatments. In total, 13 million. Do you remember the measly numbers of 250,000 in the surgical procedures? 13 million. Okay, so what were the top ones? Look at this. Botulinum toxin, 4.4 million procedures. Okay, soft tissue fillers, 3.4 million procedures. Laser skin, almost 1 million procedures. Chemical peels, almost 1 million procedures. IPLs, almost 1 million procedures. Now, if we go back again, just for reference, let's look at the surgical procedures. If you add them all up, they're coming somewhere around 1 million in total. So you can see clearly what the public wants is minimally invasive procedures. Now, here's the kicker. If we look back here, we take the non-surgical procedures. If you think all these procedures here, people are going to come a few times a year for these. You can see easily where successful practices, especially ones that have been around for a while, are closed to new patients. How do you keep up with those numbers when your patients want to come every few months? Contrast that with the surgical procedures for a moment and think about a nose job, a rhinoplasty, or a facelift. Those two procedures, if people have had one done, they really never want another one done. And for a nose especially, it's typically and should be a one and done, hopefully. But for a facelift, people think about one per lifetime. Now, some people certainly do get multiple, but in general, after someone's had one, they would rather not go through it again. You can see where on the surgical side, you need a steady stream of new patients, which is why you're hearing a lot of what you're hearing online, on forums, and in social media today. Okay, so why are minimally invasive treatments crushing surgical procedures? 6 factors to consider. Number 1 is pain and downtime. So a lot of people don't want the pain or the time away from work and family. So for the first few days, often there will be a drain, particularly with a facelift. Take the drain out, the surgical wounds heal, and at about 2 weeks, people can go back to social activities. But honestly, people aren't going to look the same or feel like they look presentable to their family members, or especially people they don't want to know that they've had a surgical procedure for about 6 weeks, and the total healing time is about 6 months. So it's a major deterrent. Whereas people come in, I just had a Dysport here in the frown area, took about 3 minutes to do. It's a couple $100, and that can make a quick difference in someone's life. In and out, no downtime. So people are weighing that. Certainly that plays a role. Number 2 is money. So it's an elitist procedure in terms of the cost. So it's over $20,000. In my area, it's $25,000 would be the average. Once you pay the surgical fees, the OR time, the anesthesia, and so on. If you go to places where it's very prominent, let's take Southern California, most people you see online are charging anywhere from $50,000 to $150,000. People are trying to get food, good organic food, nutrients, diet, exercise, gym memberships at $30,000 to $50,000 to $100,000. It's out of reach for the majority of people. And consider, I told you 230,000 people had facelifts. There is in the United States today roughly 330 million people. That's 0.06% of the population were able to get facelifts. 0.06%. That's a very small proportion. Money is a consideration for many. Number 3, you're still going to need minimally invasive aesthetic procedures. The facelift does a good job of lifting, definitely release the ligaments, remove the skin. But what about your pores? What about your brown spots? What about your frowns? What about lip size to balance the face? Vertical lip lines, peau d'orange, chin dimpling, downturn of the mouth. It will address that a little bit, but everything else I mentioned, you're still going to need lasers, peels, neuromodulators like Botox, even fillers, and people get threads after a facelift because they still want a little extra lift. So it adds to the cost, the downtime, and getting a facelift does not negate minimally invasive aesthetic procedures, of which the technology is improving all the time. Number 4 is a consideration. Think about this. Has your facelift doctor had a facelift? Think about that. There was a study done on breast surgery, breast implants in particular, and they looked and thought, hey, are female plastic surgeons getting breast implants? And they get them at a much lower rate than the general population. That means they're not drinking their own Kool-Aid. Some things make you go, wonder why they're not getting them. But if you ask them, they'll have Botox, they've had fillers, they've had RF microneedling, all the other things in the office, but they likely haven't even had a nose job or a facelift. So it's an interesting question. If you go to a minimally invasive aesthetic clinic, they've had everything that they do in their clinic. Like myself, sculptor, biostimulators, we try everything before we try it or do it on our patients. It's a factor to consider. Next is shame. Yes, it still is that way. I did a poll on my YouTube community section, and 59% of people said no, they wouldn't tell other people that they were getting even neuromodulators or fillers because they didn't want other people to know, because they're being shamed or guilt because they got it done. Still here in the United States, at least, it's not considered a badge of honor. It's not thought upon positively, and so people try and keep it a secret. Very hard to keep a facelift a secret. A final consideration is the body. So when people take care of their face, the next thing is the décolleté, the arms, the loose skin on the knees. Minimally invasive biostimulators, RF microneedling, things like Kybella that reduce fat, they can work on the body. So if you're spending your budget, you not only want to consider your face, but your body. If you're getting surgical procedures, it really puts you up into the elitist world that can afford it, because it just takes it definitely off the map or the radar or of people with any sort of budget. But if you're doing minimally invasive, you can add the body to it. Now, let's say you get a 20 to 40% improvement. That's pretty amazing if you consider that you're going to address the face and the body. Some of the results aren't, of course, going to be what surgery does, but for many people, they don't necessarily need the full result of surgery, the risks that go with it. With minimally invasive treatments, people have the budget to pick apart areas of the body that they want to address to keep the face congruent with the body. Not only that, but they can do it on their time frame without any downtime, without people knowing, where you get a gradual result that doesn't show as this drastic change. What procedures are you going for this year? Agree with me or disagree? I want to hear in the comments below. Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.